Okay, let's get to another person's question. How to manage the fear. So many people have said, I'm terrified of getting the virus.
Yeah.
When I talk to someone and they're just a wreck, oh my gosh, I think I have it. I think I'm going to get it. If I get it, this is what's going to happen to me. How do you respond to something like that?
Good time for me to say that Dr. Egan and I right now work in an office together all day long. We're still seeing patients all day long. We're on our own Zoom meetings with patients as well. You and I are several feet apart here. We're social distancing. Social distancing is important. We're a little bit closer because we're in the space together all day anyway. But what's your thought?
I think, there's still so many questions about who's the most vulnerable to get the virus. If you get it, the majority of people have a very mild case. Some of the estimates now are that 50% of people who get it will never know that they even had it. So many people who are worried that they're going to get it already had it.
And they're kind of psyching themselves
Yeah.
up.
That's
like
right.
they're talking themselves into this frenzy, and it's all self-talk.
That's right. And, the estimates are about 10% of people have a little bit of kind of hypochondriasis anyway. So about 1 in 10 people tends to be more thoughtful about being sick, or I'm worried about my skin, or I didn't sleep, therefore I'm not going to have a good day. So that they're already predisposed to it anyway. I think to limit how much time you spend watching television and listening to newscasts.
Oh, that's a good idea.
Turn the news off.
Turn it
Yeah.
off.
Yeah.
You can get an update in the morning or in the evening, but this minute
All
by
day.
minute
Yeah.
onslaught
Yeah.
is not helpful
Right.
for people. I think to also remember that the vast majority of people who do get sick recover and do well. That doesn't make news. News
Right.
about how many people got better is not really interesting news. That our minds are gravitate more towards a negative story. So I think that's important. Then to follow common practices that you hear every morning. The Surgeon General is reminding people about social distancing and about hand washing and about kind of covering their mouth and things of that nature. So just pay attention to that. Do what you can.
Yeah, do what you
Be
can.
sensible. I think sometimes it's frustrating to see, for example, people in New York when Central Park is just packed with millions of people, even though the government had asked if they would
Right.
not do that. Remember, that's not being sensible. The likelihood of having a problem is increased if you do that.
Right.
So try to follow
Just
the
listen.
guidelines.
Yeah.
Yeah.